The U.S. Navy hospital ship Comfort is admitting coronavirus patients. But that wasn't the ship's original mission.
We have 80 ICU beds, for example. They are open bay ICUs, something that you wouldn't typically see in an American hospital anymore.
It was supposed to help New York hospitals overwhelmed by the pandemic by taking non-coronavirus patients off their hands. Officials had previously expressed concern about what bringing coronavirus patients in would mean for others on board.
If we open it up to COVID patients, the likelihood of infection of our doctors goes up.
My concerns would be for any other hospital commander across the country. We want to make sure our people are safe. We will follow the guidelines to the T to ensure that whatever we can do, we are doing to protect our crew.
After the Comfort could only fill about 4% of its capacity with trauma patients, New York Governor Andrew Cuomo requested that President Donald Trump designate the Comfort to treat coronavirus patients as well. But the Navy said it found a way to isolate crew members and patients by dividing the ship into a green and a red zone. In the red zone are the doctors and nurses that interact with patients. Once the approximately 500 medical staff members are done with their shifts, they're taken off the ship to an isolated, undisclosed hotel. On the green side is where the crew members run auxiliary services and the ship's plant. These crew members stay on board the ship in their own individual staterooms. Crew members are not allowed to go back and forth between the red and green zones. Governor Cuomo said on Tuesday the ship's capacity will also be cut in half to 500 beds.
COVID patients require a greater treatment area, more space, and therefore the capacity of the ship came down from 1,000 to 500. It's still a tremendous benefit.
As of Tuesday evening, there were 5 coronavirus patients on board the Comfort. A Navy official told reporters that the patients had tested negative when they boarded the ship, but later tested positive. Patients who are in a less dire situation are being taken to the Javits Center, while those who may need intensive care will be treated at the Comfort. According to multiple media reports, a crew member aboard the Comfort also tested positive for the coronavirus and has been isolated. Officials said the incident will not affect the ship's mission and ability to receive more patients. Before the coronavirus cases were reported, the Navy had strict intake rules.
Is certain criteria or exclusions for admission to the ship.
People had to first be taken to a hospital to be screened and tested. Once they tested negative, which could take hours, they were taken by ambulance to the Comfort. But the process, done through a central communications system, turned out to be long and bureaucratic. The head of one hospital in the city describing it to the New York Times as a joke. On top of that, officials have also said that a shelter-in-place order in New York may have caused a decrease in traumas, injuries from car accidents, or assaults, things the Comfort was there to treat.
So the original plan, which was the Comfort would take non-COVID cases from the hospitals, didn't really work.
As of April 7th, the ship with a capacity to treat 1,000 people had treated only 44 people. Now, as the Comfort takes COVID-19 patients on board, crew members say they will do all they can to help during this health crisis, despite the risks.
I would like to thank the families of the crew that are aboard, because this is a national crisis, and they had to wait for their loved ones in Norfolk as we pulled away to head to New York City. We're open for business, and we want to do what we can for the citizens of the city.